Hello, dear friends. Today's our topic is the maxillary central incisor. In this video, we will discuss about the permanent maxillary central incisor. The maxillary incisor as introduction, anatomical positions, the numbering system, development and eruption, the labial, lingual, mesial, distal, and incisal views, the root anatomy, clinical significance, and lastly, we see the conclusion about it. Let's we discuss in this video. Introduction to the maxillary central incisors. These front teeth are like the stars of your smile. They are right in the center. If they look good, your whole smile look like good. They help your lips shine safe, reflected light to make it shine and keep your smile looking even and nice. The anatomical position we will see it is exactly midline location. In this rectangle, we will see the midline location of the mouth. The maxillary central incisor occupies the dental arch midline between the right and the left lateral incisors symmetrically. Then, what is the numbering system of maxillary central incisor? We will see and discuss about the different numbering system given in the world. In FDA system, the maxillary central incisors are 1 1 and 2 1. The Palmer notation system is given by 1 and 1 with the different brackets. In the universal number system, we will see tooth number 8 and 9 about it. Then we will see the development and eruption of the tooth. Eruption timeline. Primary maxillary central incisor erupt between 8 to 12 months. Permanent counterpart emerge around 7 to 8 years. The developmental stages, we will see the tooth development progress sequentially through the bud stage, then the cap stage, and then in the bell stage. And the calcification proceeding eruption. Calcification process is the initiation of the enamel and dentin mineralization occur post-bell stage. It is crucial for structural integrity before eruption. Then we will see first the labial view. What is the crown shape? It is trapezoidal in the shape. Then we will see the measurement. Average value of crown length is 10.5 and the root length is 13 mm. The contact point is in the incisal third. What we will see? We will see the contact point area. We will see in the diagram it is a trapezoidal in shape and the average value of crown length is 10.5 and in this the root is 13 mm. The incisal third is the last one area we will see on the crown. Incisal is straight and sharp in young teeth. Labial surface have a developmental groove, shallow line indicating the lobe of development. We will see the cervical line curved toward the root. The cervical line is curved toward all the roots. Then in the next slide we will see the lingual view. The lingual side is the inner side of tooth that side your face, your tongue. This is a side anterior. The bolus are attached with this side. Cingulum, it is a small rounded bump near the gum line. This we will the cingulum portion. This is a small rounded bump near the gum line. You will feel in your mouth. The lingual fossa is a W-shaped depression in the midline of the lingual surface. This is W-shaped depression seen. The marginal ridge are raised edge on the left and right side of the fossa. The mesial ridge toward the center of your mouth. It is usually longer than the distal ones. The incisal edge, you can also see the biting edge of tooth from the lingual side. It may look a little sharp of ridge like. Then in the next slide, we will see the mesial view. The crown shape is a triangular base at the cervix, tip at the incisal head to be cutting foot. The labial surface is a slightly convex, smooth, gently curved outward. In the lingual, convex, concave, flat bulge near the cervix, dips in the midline, fossa then flat near the edge. The cervical line, deep curve toward the round side, you will see more curve than the distal sides. This is a mesial side. We will see exactly the midline of our face. The contact area is the incisor third, close to the biting edge when it has the other central incisor, important for alignment, preventing food traps, etc. In this, the distal view, we will the feature and the description about. The crown shape is also triangular. Labial shape is also like the Mesial view. Lingual surface is the same as the mesial view. Cervical line is a less curved than the mesial view. The contact area is cervically mesial distal, usually the junction of incisal and middle third. It helps maintain spacing with lateral incisors. We will see the differences between mesial and distal slightly less sharp in the distal view, above and away from the midline. It is a less curved toward the incisal edge. Then we will discuss the difference between mesial and distal contact area. It is a majorly asked in our examinations. Features: the cervical line show deeper curvature toward the incisal edge. Incisal edge is the edge where we cut our food substance. It is a distal curve less than the mesial side. Contact area is the incisal third, and it is the junction of incisal and middle thirds. Outline is sharp and more straight in the mesial and in the center of our teeth. It is a more rounded or slightly curved. You will see in this box. We will discuss about the incisal aspect. The shape is look like a triangle. Side is wide to wide. Side to side is more. Mesially is more than labiolingually. Incisal edge is a straight. Labial surface is smooth and slightly curved. Lingual side you see the cingulum. The symmetry is even balanced from both all the sides. The root anatomy of the maxillary central incisor is the number of root is a single root edge. The root shape is a cone shape. It is wider at the cervical part and tapered toward the apex. The apex is the blunt. The length of the crown is about 13 mm long. The cross section is at the cervical line. Neck is triangular and deeper. It is oval or rounded. The root canal is a one root canal. It is straight and wide, especially in labial-lingual directions. The clinical significance of the maxillary central incisor is it is aesthetics. It is the most visible tooth. It helps in speech like D, D, and L. It is function is cut food during bite. It is orthodontics and braces alignment especially is very important for it. The restoration is a fracture, discoloration, and trauma need care for restorations. The conclusion we will lastly see is it is one of the most important anterior teeth. Its crown is a rectangular from front, triangular from top view very symmetrically. The root is a single conical blunt apex. The function is cutting food, helping in speech, supporting lips. Clinical use is aesthetic restoration, smile designing, and orthodontics. The common issue is not we will see, but in the discoloration in trauma, knee engage is a common issue. Always remember the main tooth for aesthetics, cutting, and alignment. Let me know if you the fun with summary express. Thank you. It will be completed.